Thank you so much, Peter. Thank you, Stefan, for the invitation. Thanks everybody for having me today and for all the work that you're doing with Medicare for All Connecticut. Yeah, I'm Bill Honigman, retired emergency room physician, and been a bit of a political junkie all my life, going back to my youth when I walked precincts for Eugene McCarthy because he was the guy to end the Vietnam War. So I go back that far. I haven't been working for single payer that long, or quite that long, but I did in my research find a bill in California in 1971, the year I graduated high school. That was a single payer universal healthcare bill put forward by our Speaker of the Assembly at the time, Willie Brown. Remember Willie Brown of San Francisco? He put forward a single payer bill in 1971 for California, believe it or not. So anyhow, so yeah, thank you. Stefan asked me to speak a little bit about Medicare for All in general in California, and of course, to answer questions that you all have, all in the span of about 30 minutes. So we'll go the first 10 minutes, we'll talk about kind of the national scene, especially as relates to the pandemic. And I like to say that the pandemic is a giant wake-up call for Medicare for All, as well as the Green New Deal, because we know there's more pandemics headed our way with rising global temperatures. But certainly for Medicare for All, as my friend in the movement, our friend in the movement, Michael Leidy, who was head policy advisor on healthcare for Bernie Sanders, likes to say, we've won the policy arguments on Medicare for All. Now we just have to win the political argument. But the policy argument is a moral argument on saving lives, but also on saving money. And COVID-19 is a great magnifier for that. So I'm going to show just a few slides here that I think really kind of demonstrate that point for you all. And hopefully everybody can see my slides. Can I get a thumbs up from Peter or someone? Yep. Okay, great. So thank you. We might not all have thought about it in this way. Like, you don't hear a lot of even people inside the movement thinking of this related to the pandemic and COVID-19, especially as a magnifier. But we know, as Dr. King said, injustice anywhere is a threat to justice everywhere. That's certainly true of this virus, that when it's a threat anywhere, it's a threat everywhere. And that means that, it's or what I say is the for all part of Medicare for All. It really has to be for all. And we can see how, our current situation is not treating everyone in an equitable fashion. But the science on this is really what is driving, it should be driving the argument, the political debate at this point. And it's based on hardcore economic and social science. And here's a bill from California, dates back in early 2004, California SB 921, an independent financial analyst group called the Lewin Group did a study on how that single payer proposal, with a full financing scheme laid out, would have saved businesses an incredible lot of money. And you can see this is a very well-respected independent financial analyst group. It's not some progressive think tank type thing. When you say the Lewin Group, most people believe that, like they would say, I don't know, the Wall Street Journal or something. So, but small, medium, and large businesses all saved money, by in 2004 dollars, as much as up to say $2,500 per employee. It's kind of an upside down horseshoe, meaning that it saved money, across the board for businesses, and did better than that even for households. And why is that? That's because of this. This is a little schematic that was drawn by another good friend of the movement, Dr. Henry Broska. He's a health systems analyst and expert. He designed these two schematics. He's himself a Canadian who moved here to the States, and he said, you know, gee, people ought to have something to compare how they pay for healthcare in Canada compared to how we pay for healthcare in the United States. And hopefully everyone can tell which is which, right? So here's obviously the U.S. how we pay for healthcare. This is the big clue down here. It's provincial, the provincial payer. Okay, but you start your patient visit up here. And by the time you're done, it's paid down here. In the U.S., you start up here, and then it's paid down here. And he says he couldn't fit all of the various agencies that are involved that get in the way on one page. He's had to actually make 4 or 5 layers to this scheme that he's drawn out there just to accommodate all the hoops and red tape and all that stuff that you have to go through to pay for healthcare bills in this country. But clearly, this is not just administrative waste. This is also fraud and abuse. So it's waste, fraud, and abuse. This is an opportunity for backroom deals and behind closed doors negotiations that end up with surprise bills, that end up with these outrageous predatory prices that you see in hospitals and clinic settings and for testing and all kinds of things, and also abuse in the sense that it's extortion. It's like a big pharma does not price their product based on what it costs to produce it and distribute it. They base it on what's it worth to you, what's your life worth to you. Just like the mafia says, hey, that's a nice kid you got there. Be ashamed if something happened to him. That's what's going on here with how we pay our medical bill. It's an extortion business model practice that is, encouraging waste, fraud, and abuse. Now, all of this is magnified in the pandemic situation, and that's what I hope everyone realizes here. The chance for savings is even greater, and so when you hear politicians, office holders say, well, we can't afford universal health care now. No, we couldn't afford it before. We really can't, afford, to not have universal health care now because everything has gotten so much worse and so much more expensive. The only way we can afford to take care of people is with a single payer system that saves us from all this waste, fraud, and abuse. So that brings me to this, kind of a few items here to look at in some detail, which is that, once again, big insurance and big pharma are controlling, they're setting the priorities in terms of access, and which leads us to, underserved populations and disparity in care. And that's very obvious now that we can see in this pandemic where, especially communities of color are not getting the care that they need, rural communities and inner cities both. But all of us are not getting universal testing. We're not getting contact tracing because the systems are protected for proprietary reasons. Our hospitals don't talk to one another because they can't share that information, and so that means we don't have the benefit of the knowledge of knowing the extent of the problem that we have right now. And then finally, treatments, various kinds, tests that sound or treatments that sound very exotic, like monoclonal antibody therapy. I mean, not just the vaccines, which it's not the pharmaceutical companies are not coming up with vaccines out of the goodness of their hearts. No, they're mostly publicly funded, or even by some independent folks who are chipping in, like Dolly Parton and others too. But really, it's because it's the whole range of treatment, and that includes chronic medical conditions. That if your heart disease, your diabetes, and high blood pressure are not well controlled, they put you at risk. It's the personal protective equipment, the PPE, that not only every one of our healthcare providers need, all our doctors and nurses, clinicians of different kinds, but also in the skilled nursing facilities, nursing homes, but also in prisons and detention centers. Any congregate living situation should have all of that. Why aren't we getting it? Because big insurance and big pharma are calling the shots, not we the people. I mean, like Robert Reich said, you can't have a public health system unless the public is in charge of making those decisions. We also have this curious phenomenon called a public-private partnership. That's otherwise known as profitization. I mean, that's somebody pulling profits out of the resources that should be applied to the public need. And again, that's just immoral, and we need to get rid of that. So anytime you hear Mike Pence or someone like that bring up a public-private partnership, we need to discount that altogether. Not to mention all of the cutbacks that we saw, especially in the previous administration, that would be considered to be austerity measures that leave, in particular, various populations even more at risk in terms of housing and food scarcity and childcare and just jobs. So that obviously is worse and making things worse during the pandemic. So of course, what we're left with is wellness for the wealthy, and leaving too many people uncared for. And again, that's a threat to all of us, not just some of us. And again, we can expect more yet with these climate changes that are headed our way. The coronavirus that we're dealing with now is called a novel virus because it's new, but it's really in a spectrum of a lot of pathogens that are new. All of these SARS viruses, like MERS, and Ebola, all of those viruses are new. They start out new, and are happening because climate is changing. But we're also going to see other environmental toxins and traumatic displacements that need public health, a real public with public decision making, not private commercial decision making to do that. So what are the to-dos out of all of this? Everyone here, I'm sure, knows on the national scene, it's the Medicare for All Act. We're all expecting to have rolled out once again anytime now from Jayapal and Sanders. It's the state-based Universal Health Care Act. That also should be rolled out again previously from Ro-Khanna, and the Healthcare Emergency Guarantee Act. I mean, any one in Congress or the Biden-Harris administration themselves, in my opinion, could pick that up and run with it and basically govern our way out of our present situation. So that brings in number two. We need to apply that kind of pressure, not just to the federal government, but also to the local government. And that's where we can put pressure on our state houses, on our governors. My governor, Gavin Newsom, is being threatened with a recall. Why is that? Because a lot of people are unhappy with how basically they're unhappy with the situation that we're in. Well, we're all in this situation. It's a pandemic. Is he responsible for COVID-19? No. But unless he shows a decisive leadership on how to deal with this, then they'll actually vote him out. And we've done that before in California. They'll do it again. So here's an opportunity for him to govern his way out of a recall, which he could do in California. We do have a bill that is, it should be introduced shortly, another bill. In the meantime, we're pushing him to apply for the Affordable Care Act Section 1332 waivers. He did under Trump, first day in office. But now he has not done that again since Biden and Harris took office, and we're not sure why. But a number of us have, we've started petitions across the state in large coalitions and also inside the Democratic Party on our county central committees. We're pushing Gavin Newsom to reapply for those Section 1332 waivers with the knowledge that we will have a single payer bill reintroduced into our state house shortly. And I imagine you all have similar efforts going on in Connecticut too. And it's great to hear that you do have a bill. And then finally, it's the work that we're doing with all our coalition partners, like PDA, National Nurses, the Labor Campaign for Single Payer Healthcare Now. The National Union of Healthcare Workers is really stepping up. Of course, it includes many more healthcare workers than just the nurses. All clinical, clerical workers, mental health workers especially need support and are more and more getting on board with Medicare for All. PNHP, of course, are stalwarts. Public Citizen, great to see them involved, and Center for Popular Democracy also stepping up as real champions, and down the list. And so good to see the sponsors in this meeting. So finally, of course, it is, as Dr. King said, the ultimate injustice to see healthcare as so shockingly unequal and unequitable or inequitable. So I think that that is what's driving the discussion and driving us all, in our pursuit. So with that, I would just I think we pulled in pretty much what I had to say about what's going on in California as well. And I would open it up at this point to questions or comments. Thank you again for having me.
Thank you so much. I just wanted to follow up and ask, so I heard since Connecticut has its own single payer bill effort right now, that in California, things look very promising. So I would love if you could provide us an update to that. And then in addition, I would love to hear more just your personal perspective. So obviously you are emergency care physician. So what, so to speak, was your experience practicing, and how did it inform your view for the need for Medicare for All? And then finally, I realized, since you are with, of course, PDA, Progressive Democrats of America, in case you could fill us in a little bit more about the connections between PDA kind of bringing Medicare for All as a concept into place. So I hear from, for example, Joel Siegel being involved in the first Medicare for All bill being written back then in Representative John Conyers' office. Yeah, I would love to hear a little bit more background on all of this from you. Thank you.
Thank you so much, Stefan. So sure. I don't, I think like a lot of speakers, I don't like to talk about myself that much, but I do think, I had the occasion practicing in the emergency room to see so many people who fell through the cracks, of course, and ended up in the ER as kind of the final common denominator, the court of last resort, kind of the black hole for problems. And I remember early on after I did my emergency training, one of the first jobs I asked one of my new bosses, I said, it's interesting because you think of emergency, and even in training, it was, there was trauma, there were medical problems, all kinds of problems that would come in. And, he asked me how I liked working there. And I said, Well, it's great. I said, but it's kind of shocking to me how many people are coming here because they have nowhere else to go. They can't get to see a doctor. They have conditions that aren't being taken care of anywhere else. Anywhere else. Period. And he said, yeah, that's probably about 90% of what we do. And that was what, 40 years ago now. So it has only gotten worse in the meantime, so that's what you end up seeing to a great extent. I mean, it's not just the uh, the heart attacks and strokes that probably happened because someone wasn't on medication that they should have been on, didn't have their diabetes or high blood pressure controlled, but it could have been something very, simple, like a toothache, an infected tooth, and they'd end up seeing me in the middle of the night with a big swollen face, needing IV antibiotics and surgery, and all this stuff if they had just had dental care, um, so there was a whole lot of that, and not to mention just being connected, uh, having a home base, and or a medical home kind of thing. I know Bernie Sanders pushes for community health centers, and they do a lot of that in Canada and the other universal healthcare countries around the world. Um, that sounds good to me too, but I do think that over an entire career, it was kind of driven into me. And I used to work night shift and weekend night shift, and you'd see even more of it on weekend night. Um, but then again, I've always been driven to be involved politically. So that got me into, well, who are the bad guys here? Who are trying to keep the system the way it is? That's the status quo, right? So the status quo is, there's one party that's the party that's fully owned and operated by the status quo, by the corporate status quo. Then there's another party that seems to be partly, owned and operated by the status quo, but also has a lot of grassroots type, activist type people involved in it. So that was a realization that I came to over time, that it was worth pursuing inside the Democratic Party. Now, at this point, we don't have any third party. We have some independents and no party preference, but not organized in any way. So to me, that's why I kind of took uh, 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 took on to a group like Progressive Democrats America, where we support the progressives um, in Congress, in state houses, at the local level, and where there aren't progressive Democrats, we will put up challenges, in primaries to get them there. And it's on issues exactly like this, like Medicare for all or the Green New Deal. And that's because those are the things the people need. It's not what corporate America needs or wants or the status quo, but the status quo is getting us in this big giant mess that we have now. So I don't know if that answers all of those questions, but it kind of takes you from the background into the foreground. And I would say, I think I mentioned before everybody came into the meeting, um, uh, in Progressive Democrat, in PDA, I do head up our healthcare issue team. And we have had, for years now, we've had monthly meetings, which you all are welcome to. During the pandemic, we upped that to once a week because there's so much news and discussion going on around COVID-19 and the pandemic, and especially as it relates to Medicare for all. And y'all are welcome to join us. I just threw that in the chat. Every Sunday, 4 p.m. Eastern, everybody's welcome. Did you just mention it, Stefan, or was that before everybody joined? I can't remember now. Anyhow, there it is in the chat. So we've had great, this last week, last Sunday, we had a terrific discussion on vaccines. And so we're still working on the program for this coming Sunday, but by all means, check back with us again toward the end of the week for the information on the program coming up too. So anything else? Any other questions, comments?
I think just real quick, we had one last question about the status of the California state level single payer. And then I think, unless there's any last minute questions there, we can move on to Councilwoman Bermudez from Hartford.
And the question was?
Oh, just what's the current status of the
Oh,
state level single payer in
I
California?
think I mentioned I probably went over it too quickly.
Oh.
My wife is always telling me to slow down, don't talk so fast. We have, apparently we have an author for a new bill. We had a bill 2 years ago that got shut down by the Speaker of our Assembly. It turns out our Assembly is more conservative than our Senate. The Senate passed it in Sacramento, and then the Assembly shut it down. The Speaker would not put it through the committee process, and you know, takes a lot of money, big bucks from big insurance and big pharma. So that guy, and you know, dishes it out to a lot of his fellow Assembly members. We're looking at a bill to be introduced hopefully this week, a single payer bill now from the Assembly, and we've got 3 Assembly members on it. So so that should be, you know, that's very promising. And again, we're pushing the governor to apply for the waivers, and hopefully that pressure on the governor is applying pressure to the Speaker. It's the same Speaker of the Assembly. So hopefully that's putting pressure on the Speaker now to allow these Assembly members to come forward with the new bill.